Now we'll be doing the neurological assessment. So first you're going to assess the level of consciousness.
Justin Bieber, can you tell me your mommy's name?
And then we're going to be doing the Glasgow Coma Scale. Then we'll be assessing the cognitive function, the developmental stage for the patient, which is Erickson's stages. For our patient, he's a school-age child, 6 to 12 years. So his ego development outcome is industry versus inferiority, and his basic strengths are method and competence. So during this stage, often called the latency, we are capable of learning, creating, and accomplishing numerous new skills and knowledge, thus developing a sense of industry. It's a very social stage of development, and if we experience unresolved feelings of inadequacy and inferiority among our peers, we can have serious problems in terms of competence and self-esteem. Also in the neurological assessment, we're going to be doing the sensory function, which is the cranial nerves. So the 12 cranial nerves, I'll just go in order. So the first one, the olfactory, is going to be the smell. So we'll be holding something up to Justin's nose and seeing if he can identify the smell. The second optic cranial nerve is sight. So we'll be putting something in front of Justin's face and asking if he can identify it, such as Poppy the popsicle stick or a pen. For the third cranial nerve, the oculomotor, movement of the eyeball, lens, and pupillary sphincters. So we'll be putting our finger up in front of
follow my finger?
Justin's face and seeing if he can follow our finger. For the fourth cranial nerve, trochlear, superior oblique muscles of the eyes. So that also goes with moving the eye. For the fifth, trigeminal, so then those are the muscles of mastication. So we'll be seeing, might give him something to chew on, so let's see if he can use his trigeminal nerve. For the sixth cranial nerve, abducens, moves the eye outwards, so that's also assessed whenever we assess for the third cranial nerve. The facial cranial nerve controls the muscles of the face, scalp, and ears, controls salivary glands, receives taste sensation from the anterior 2/3 of the tongue. So we would give something for him to taste and see if he can make facial expressions. For the eighth cranial nerve, acoustic, if he's answering us and obeying commands, meaning he can hear, and whenever we would do a motor assessment, if he can walk and balance and have equilibrium. For the ninth cranial nerve, glossopharyngeal, sensations from the pharynx and posterior 1/3 of the tongue. So also if he can taste whatever we give him, whether it be salty, bitter, sweet, sour. For the 10th cranial nerve, the vagus, sensory and motor, thoracic and abdominal viscera. That is the organs. For the 11th cranial nerve, the accessory, permits movement of the head and shoulders. So if Justin can lift his arms.
Justin, can you lift your head up? Can you move your arms?
Okay, and for the 12th, hypoglossal, controls muscles of the tongue. So if Justin can stick out his tongue.
Can you stick your tongue out really far? Good job.
Okay, and finally, with our last part of the assessment is the deep tendon reflexes. And so for this part, we will be sitting Justin up on the side of the bed.